Hey, it's Dr. Ken Starr with the Wellness Group in Rio Grande, and I wanted to talk for a moment about Lofexidine or Lucemyra. So I'm kind of famous now for being wrong and correcting myself as I learn more about things. I've done that with Sublocade, and I've done that a few other times. So yet again, I want to add more information to a post maybe a year or two ago about Lofexidine or Lucemyra. So one of the drugs we've used for opiate withdrawal for years is clonidine. And I always kind of thought we were just treating ourselves when we gave clonidine, not the patient. There's some evidence that it's helpful, and I think it does help. When Lucemyra came out, that's the brand name, the generic name is Lofexidine. That's been approved since like 1992 in the UK. Initially it was a blood pressure medicine, and here in the US since 2018. It's the only FDA-approved medicine for acute opiate withdrawal. And I didn't really see a difference. It was like 100 times the price. They're both alpha agonists, reducing sort of central nervous system tone. And I just didn't see, I thought it was kind of a designer drug that didn't really offer more. I thought, we'll just use more clonidine. You do get some hypotension or low blood pressure, but other than that, it's pretty well tolerated. Well, I started using Lofexidine and Lucemyra, and really what changed my mind is I had a kid fly out to the clinic from Texas here to detox off fentanyl, and I did nothing. Well, besides NAD, I did nothing but just give him Lucemyra, and he had no withdrawal, essentially no withdrawal for the 5 days he was here. I've since put Lucemyra or Lofexidine in the residential programs now. Through their generosity, we have samples until we can get them started on prescriptions, and it's a very robust response. I mean, this drug is more effective at reducing opiate withdrawal than any other medicine I've really seen. And I've been pretty generous using combinations with benzos and muscle relaxers and gabapentin and clonidine and so forth. But I would really say that Lucemyra is a game changer. There are some limitations, which I'll talk about next, but in terms of like what medicine can I take to reduce opiate withdrawal, Lucemyra or Lofexidine absolutely is a game changer. It's really quite effective. And I'm really impressed, and I use it now first line in lots of situations. One, for acute detox, when I just want to detox somebody. But sometimes people have been off buprenorphine or Sublocade for a while. They're still a little not feeling so great, and Lucemyra is a great option for them as well. Regarding availability, this is not a drug you can just write a prescription for and pick up at a drugstore. It does require a specialty pharmacy, and they mail it out. They'll either mail it to the clinic or mail it to the patient's house. The cash price pay, it varies. It's quite a bit more expensive than clonidine, but I've recently learned that the cash price can be not really too bad if you're using one of their authorized retailers, which I think there's only 2 or 3 in the country. So I would ask your prescriber or provider about Lucemyra if you're in a situation where you're having some post-acute withdrawal, you're anticipating acute withdrawal, you want to jump off that last little bit of buprenorphine, you've taken your last dose of methadone, you're kind of going through it, but you really want to see the light. Definitely look into Lucemyra. It's very effective. I'm very impressed. A recent study also came out. It's a retrospective chart review, but patients, when they compared Lucemyra to clonidine, Lucemyra or Lofexidine patients were 6.5 times more likely to get off opiates and be opiate-free at 1 month. And also, additionally, there's improved benefit at 6 months. So it's really not just what I'm seeing. There's some good research now that, at least compared head-to-head to clonidine, it's a way more effective medicine. Okay, so in summary, Lofexidine is a great medicine for opiate withdrawal. I think acutely, but also subacutely or post-acute withdrawal. But your prescriber or provider has to know how to get it. So have them contact the rep or the company. There's a little bit to learn, but it's not a big deal. But it does require a third-party pharmacy to mail it to you. And if you're going to go into a residential program, these medicines should be readily available. Okay, that's it for now.